G'day and welcome back to the channel. So today's video is for anyone who suffers from absolutely any form of shoulder pain or dysfunction. I just want to touch on two really important exercises that you can try today to hopefully help improve how your shoulder feels and functions and potentially start to reduce some of that pain that you might be experiencing. So as someone who's been treating shoulder pain for the best part of 2 decades, what I've come to understand is there are two main areas connecting to the shoulder that can often set the shoulder up to be dysfunctional, and the presence of this dysfunction can then express itself through a number of different channels and potentially start to irritate or injure all the different structures within the shoulder. So if you're someone who deals with any rotator cuff dysfunction, any bursitis, if you have an AC joint problem, if your long head of biceps has become an issue, if you're someone who has developed a labral tear or labral dysfunction, or even someone who has the potential to dislocate or have an unstable shoulder, these two areas that we're about to go through may form part of the underlying reason for why that dysfunction was there in the first place. Because ultimately, if we're not having a broader conversation about your shoulder pain beyond the exact structure that's actually injured, sore, or tender in the first place, then we're never going to truly understand the context behind why that may become sore, or why that may have been allowed to become sore over time. So the first area that we want to basically focus on is your upper back. Now, this may sound strange to some of you that one of the main areas that we're going to focus on isn't actually your shoulder. It's what your shoulder and your shoulder complex sits on top of. But the reason why your upper back is so important is none other than your shoulder and your shoulder blade sits squarely on top of your upper back. So if you have some restriction or some dysfunction through the musculature on the inside of your shoulder blade, or through the rib cage or the joints of your upper back that the shoulder blade sits on top of, it can act like a bit of a handbrake, so that when you're trying to lift your arm up above your head, take your arm out to the side, or rotate your arm in different positions, it can act as a handbrake to that normal function. It can force a consequence into the way your shoulder moves, change things mechanically, and change the way that you load the structures in your shoulder to make them vulnerable over time. So a fantastic exercise we've done a lot on the channel before, but is one that I think is almost the most important shoulder exercise that most people can do in order to get to the foundation of normal shoulder function, and then hopefully why shoulder pain exists. We need to take a ball. We're going to place the ball anywhere from in between the bumps in the middle of your spine out towards the shoulder blade itself. We're going to basically get you to lie down on top of the ball, and we want you to go hunting from the base of your shoulder blade all the way up to the top of your shoulder blade, almost towards the base of your neck. And all we want to do here is we want to go looking for structures and some tissues that feel a little bit stiff, a little bit tight, and potentially a little bit tender. Especially if you don't have pain in this area, it may come as a surprise to you that it might be tender. And all I want you to do as a starting point is just gently let the ball press in. Take your breath in. Relax on the way out. Encourage your brain to relax. Encourage these muscles and these stiff tissues to give. We want to stay here for 30 seconds, a minute and a half, 2 minutes, however long it takes for you to feel and notice a tangible decrease or a change in these symptoms. And then all I want you to do is, once you've done that, you can move the ball down a little bit. You can move the ball up a little bit. You can even move the ball out a little bit further towards the shoulder blade, looking for anything that feels restricted and uncomfortable for you. Now, if you want a little bit more pressure, you can definitely bridge up and get more of your body weight, more pressure through the ball. The other thing that we can get you to do as well, especially if you're finding it hard to get overhead with your movements, is that if you can find a good spot that needs a little bit of TLC, keep the ball there with your arm straight. Bring that arm up above your head as high as you feel comfortable, and then we can gently oscillate in and out of that end range until you feel like it starts to give. So for me, if I can find this spot here, this feels where I can get to naturally at the moment. I can feel the soft tissue pulling tight here. I can feel the joints not moving very well. But the more I oscillate in and out of that end range, I can then start to go further and further and further until I reclaim some of that natural indigenous shoulder range that I should have. We can also get you to rotate down and rotate upwards to see if that also helps engage some of the restricted areas that might be limiting those ranges of motion. Now, it goes without saying that if your shoulder is acutely sore at the moment, and you feel like if you go too high it hurts your shoulder, see if you can work within a range that respects that soreness, and see if, as that tissue starts to give, if your respectful pain-free window starts to get bigger, and if you can start to move further into that range. Because Because then what should happen is once you've done that, is you should automatically see and hopefully feel that your shoulder starts to move further than it did before in whatever range of motion, test or activity that you feel generates some of that soreness. So if you can go hunting up and down the inside of that shoulder blade, from the top of that shoulder blade down to the bottom of that shoulder blade, being right up against the spine down the middle where the facet joints are, the thoracic facet joints, and then moving a little bit further out to the side towards your shoulder blade, looking for where the ribs also attach into those sort of spinal facets or those spinal levels of your back as well. We want to make sure that we capture and expose as much of those hidden restrictions, those joint restrictions, and those muscular or soft tissue restrictions as possible to then feed some more slack into your actual shoulder itself and hopefully provide a better environment for any of those irritated or sore tissues that you may have to play. And the expectation is over time, as that tissue begins to mobilize and free up, then you might hope to see some of the tissue in your shoulder start to respond to that and feel better over time. So the second area that I find clinically very closely associates to shoulder pain and dysfunction is a lack of shoulder internal rotation, but more specifically, tightness at the back of the shoulder. And what the tightness at the back of the shoulder does, and why a lack of shoulder internal rotation is so important, is that anatomically, we should be able to maintain a really nice shoulder posture, have our arm out to 90 degrees, and rotate down to about 90 degrees without losing that good shoulder positioning. But if we have a ton of restrictions at the back of the shoulder, as we try and open up the back of the shoulder and rotate our arm down, if we don't have that range of motion, the only way that our hand can complete the task is if our entire shoulder wants to dump forwards. So a change in the function of the shoulder starts to load up a lot of the tissues at the front of that shoulder, which is one of the main reasons why a bicep tendon, a supraspinatus or a rotator cuff or even a bursitis could have become sore in the first place, because the way that we're loading up those tissues normally throughout our day-to-day existence has fundamentally changed because of a simple handbrake in an area that you may not have realized was there. So a really simple exercise that you can try to try and reclaim some of that internal rotation is an across the body stretch. But before we get to that, obviously check out your range of motion, where if you pin your shoulders back against a wall, elbows back against a wall as well, see how far you can rotate down into this position. You may find that your non-symptomatic side may go a little bit further. If you see that your symptomatic side doesn't quite go as far, then it could be a dead giveaway that you're lacking some shoulder internal rotation and you might be stiff around the back of the shoulder itself. So all this stretch attempts to do is to keep your arm relatively straight and take it across your body, looking for any tightness that might be at the back of that shoulder. If it does feel uncomfortable, then see how far into the stretch you feel comfortable going. Again, respect whatever that pain-free window of movement might be for you, but depending on where you are, or depending on what position you feel you can get into, we can then lift your elbow up or drop your elbow down to find the best version of that stretch for you. So for me, I can find a little bit of tightness just here. Once you've found that tightness, we want to activate that tightness to try and encourage that tissue to release. So what you can do is you can push this arm that we're stretching back into the arm that's stopping it, trying to flare up the muscles in the back of that shoulder for 5 to 10 seconds. Then once you stop tensing, if you maintain this position, you might feel that tissue will release a little bit. Then you might be able to go a little bit further into the stretch than what you could before. We want to keep repeating this process until you feel like you've stopped making change, or based on how your shoulder tolerates that exact exercise. Then again, once you've done the across the body stretch, if you get back into the same position again, you should now feel like you've gained more shoulder internal rotation than you did before, because you feed some slack into that range of motion by releasing some of the hidden handbrakes at the back. Now, if you're someone who finds that the across the body stretch doesn't feel comfortable for you, we can take the same ball that we're using in the first exercise and place the ball into that exact part of your shoulder at the back and just gently roll onto the ball. You can hug yourself if you want to. We can specifically find some of the tightness in that area. We can spend some time here letting the ball gently press in. If you do hug yourself, it opens up the back of the shoulder a little bit more, but ultimately we're just looking for areas that feel restricted, feel a little bit tender, that we can encourage to release, to feed some slack back into the structures of your shoulder, to hopefully improve whatever your diagnosis or your symptoms may be by creating a better environment overall. So again, once you spend some time hunting around the back there, finding a couple of tender spots, encouraging them to free up, then we can come back to the exact same position and shape that we found before and just see if it feels looser than it did before. So for me, it just feels smoother. This side now feels tighter than this side. But the point for you is that we want to pay attention to how you feel before and after this, not only from a flexibility perspective, but from a symptom perspective as well. So whether you have a tendon that's torn or chronically dysfunctional, you've got a bursa in there that's irritated, whether your AC joint's dysfunctional, whether there's any tissue in there that isn't perfect on a scan, it's really important important that you can improve the environment that that tissue functions within to give it the best chance to settle and feel good long term. Now, obviously with any shoulder dysfunction, it's really important to seek a physical therapist or a physiotherapist to make sure you can get the right strength exercises and the right mobility exercises to best support and optimize your shoulder function and your healing over time. So as always, I genuinely hope that was insightful and helpful. If it was, please consider leaving a like on the video, subscribe to the channel if you do enjoy this type of content. Please consider leaving a super thanks donation on the video. It does help support me and the channel. It allows me to keep making these videos. But ultimately, I genuinely hope that had an impact. But ultimately, thank you for watching, and I'll see you next time. Bye.